Hi. Today I'd like to talk about noisy breathing in infants, specifically laryngomalacia. Now there's a number of different kinds of noisy breathing that infants can have. There can be some that we call stertor, which sounds a little bit like a Darth Vader sound. Whereas a parent, you might look at your child and think, can you just cough and blow your nose or something? Other times, they may have something that sounds like a wheezing sound, or it may have something that sounds like stridor, which is by definition a high-pitched, squeaky breathing, and it may sound something similar to this. Now, anytime you have concerns about noisy breathing, this is a great question to bring up with your pediatrician or primary care provider. When might your pediatrician refer you to go see ENT? Well, some of the symptoms or signs that we're looking for is increasing amount of noisy breathing, maybe looking for some retractions, challenges or difficulty with feeding. They'll also ask about when is it occurring, what makes it worse, and if anything makes it better. Your doctor may also recommend doing what we call a flexible fiber optic laryngoscopy. Well, that's a long word to say that we're taking a small camera that's at the end of a flexible scope and putting it up in the nose and down to the level of the voice box. We do this with a baby awake. We don't want your child to be sedated because we want to get a good idea about what's happening at the time. About 70 to 90% of the time, we don't actually need to do really any intervention at all, other than continuing with monitoring. However, about 20 to 30% of the time, we may need to do more intervention. And we may first start with some medications, as well as talking about some diet modifications, and especially maybe some behavior modifications. So some things that we may recommend are feeding baby, sitting up at a more upright position, also keeping baby more upright for about 20 minutes at least after having fed. We'll also ask to do a follow-up evaluation with you and your baby, usually about 4 to 6 weeks afterwards. With all of that said, laryngomalacia most times is a completely benign condition and is something that your child will outgrow on their own.